Welcome to our channel today. We bring you another topic, 11 early warning signs of heart disease you should look out for. An extraordinary occurrence, the public face of a failing heart is often EMTs charging defibrillators and shrieking clear. After a fast trip to the hospital, the patient is taken into the operating room with an oxygen mask over his face. The early signs of a failing heart are significantly less dramatic, but learning to recognize them might help people take action sooner rather than later, avoiding one of these dramatic hospital show scenarios. There are frequently little to no symptoms associated with cardiac disease. It is for this reason why screening programs are so important. Here are 11 common warning signs to watch out for, any of which might indicate a heart condition. Furthermore, if you don't address them right away, they might be precursors of future heart illness, no matter how tiny or inconsequential they appear to be. Shortness of breath. Shortness of breath, automatic breathing, and lungs exhalation, aside from the heartbeat, go unnoticed while most people are operating poorly. When it quits working properly, though it's clear, shortness of breath is the sense of not breathing properly. The lungs of the sufferer may feel heavy, or they may feel compelled to breathe fast and shallowly. Shortness of breath can be caused by anxiety, anemia, or allergic reactions, but the underlying cause is usually pulmonary, lungs, or cardiac, heart in nature. A dangerous pulmonary embolism might start with a sudden lack of breath. Shortness of breath may develop over time as well. It might signify aortic stenosis, arrhythmia, or heart failure, for example. Shortness of breath, whether sudden or progressive, is never a good indicator to ignore. Chest discomfort. Because the heart is located in the chest, one of the most obvious indicators of a failing heart is chest discomfort, often known as angina. If a person feels pressure, pain, pinching, or burning in the chest, the heart is most likely to blame. Temporary discomfort, pain that appears to be on the surface, or pain that worsens when handled are less likely to signal a heart problem. External pressure has little effect on this pain, which might occur during rest or during physical activity. Even if the discomfort isn't severe, it might indicate serious heart issues that require additional evaluation. Every year, hundreds of thousands of silent heart attacks occur in the United States alone. Many symptoms might appear to be harmless. Left shoulder pain. It's intriguing that nerves in the left arm and nerves in the heart may both communicate signals to the same pain locations in the brain. As a result, heart illness may be misinterpreted by the brain as pain in the left arm or shoulder. This is transferred pain, and the fact that it isn't in the chest doesn't mean it isn't related to the heart or that the issue isn't in the shoulder. Discomfort or pressure in the left shoulder is a classic sign of a failing heart. If you feel chronic pain or pressure in your left arm or shoulder, consult a doctor immediately, especially if it's accompanied by other heart-related symptoms like shortness of breath. Irregular heartbeat. In and of itself, an arrhythmia or irregular heartbeat is a form of cardiac disease. Although not all arrhythmias are dangerous or suggest a serious heart condition, many are, and all arrhythmia symptoms, no matter how little, should be properly handled. Heartburn, stomach pain, or back pain. Chronic heartburn, stomach discomfort, or back pain should be avoided by women in particular. Many factors contribute to these conditions, but for unexplained reasons, women are more likely than men to have heartburn, stomach discomfort, or back pains, as well as early warning signs of a heart attack. For instance, the disease might progress to the chest or left shoulder, which are more typical indicators of a failing heart. You should be particularly cautious if you have a history of stomach issues such as nausea, acid reflux, GERD, indigestion, bloating, or abdominal discomfort. Yes, there might be a number of reasons for this, but it's worth mentioning that this could be an indication of heart illness that is particular to men. Swollen feet. Swollen feet might be a sign of deep vein thrombosis, which could result in a pulmonary embolism. Furthermore, it might be a symptom of heart failure. This is because, as the day goes on, blood tends to pool closer to your lower extremities while your heart continues to pump inefficiently. If your shoes, socks, or pants start to feel tighter as the day goes on, you may be experiencing heart failure. A blood clot might be the next symptom, which could lead to a heart attack or cardiac arrest. Lack of stamina. Contrary to popular belief, we associate exercise with a healthy heart. However, keep in mind that a sedentary lifestyle is a risk factor, not a cause for heart disease. People who live active lifestyles and engage in rigorous exercise routines, on the other hand, are more prone to acquire heart disease, especially if they already have a cardiac condition. Changes in your body's ability to tolerate exercise might be a sign of imminent heart failure. Keep an eye out for symptoms such as dizziness, chest pain, nausea, or shortness of breath while exercising. Furthermore, excessive sweating, particularly a cold sweat, might be a sign of imminent heart disease. Sexual health problems. Various reasons might cause erectile dysfunction, which can be properly addressed with medicine. Persons with other risk factors such as diabetes, obesity, a family history of coronary artery disease, and other symptoms, particularly males, should investigate the possibility that problems performing might be an early sign of coronary artery disease. One of the first signs of coronary heart disease is endothelial dysfunction, or the inability of blood vessels to dilate properly. This impact, however, is rare in that it affects the penis's erectile function. As a result, address of the symptoms while also investigating the possibility that heart disease, not a diminishing libido, is to blame. Feeling dizzy or lightheaded. The signs of a lack of oxygen in the brain which can lead to a stroke include dizziness and lightheadedness. Inefficient oxygenation of the brain might be caused by a lack of blood flow to the brain or a reduction in blood oxygenation. This might be due to atherosclerosis, valve issue, or heart failure. Dizziness while standing up is a common symptom of heart disease and blood pressure issues because gravity pulls blood closer to the ground and the heart needs to work more to pump it to the head than to the feet. If the heart can't pump as hard as it should, dizziness and lightheadedness are early indicators of trouble. Sleep apnea. Sleep apnea is a condition in which your breathing continuously stops and restarts while you sleep. Although it is usually associated with snoring, sleep apnea is not always associated with snoring, and not everyone who snores has sleep apnea. Sleep apnea is a potentially fatal sleep condition that can result in diabetes and heart disease. Age, obesity, diabetes, and alcohol or prescription medicine addiction are all variables that might cause sleep apnea. Heart failure, on the other hand, may hinder brain activities such as the involuntary breathing reflex. As a result, patients with sleep apnea should check their heart health on a frequent basis. Constant fatigue. Fatigue can be caused by a variety of things, such as the flu or bacterial infections. Fatigue, on the other hand, is a common sign of heart failure since the body is depleted of oxygen. So keep a lookout for a gradual or abrupt increase in the difficulty of formerly straightforward everyday tasks. I hope you enjoyed this episode. Thank you so much for watching, and do not forget to subscribe and hit the bell button.